Okay, so now I will be doing trach care. I would not have left the patient's room. I was just cleaning up some of the mess that I had, but I would never leave them. I would perform hand hygiene again. My patient already knows who I am and why I'm there. I've already verified them by their name, date of birth, allergies, and pain since I never left the room. So I just got my supplies ready for my trach care. I have a new inner cannula for the patient. I have my sterile water, and I have my trach care tray. So my patient is already sitting high Fowlers, and I'm going to go ahead and get started. So I will go ahead and open up my new inner cannula for him. I'm going to go ahead and open up my sterile water. And I have my trach. Put my gloves on. Okay, so let me get rid of the stuff that I don't need. I don't need these brushes and pipe cleaners, so I'm going to get rid of that. And I do have my Q-tips in here, my gauze. I do not need my drape. And we are all set. So since this is sterile and my hands are still sterile, I'm going to go ahead and grab my new inner cannula and place it in my kit and bring this closer, and I'm going to be ready to do my trach care. So this is going to be my contaminated hand. So I have my sterile water. I will go ahead and pour here. Now that my hand is already contaminated, I'm going to go ahead and take off the trach collar. I'm going to remove the old dressing, and I will remove the inner cannula. So now that this hand is contaminated, I'm going to use my sterile hand and place the new cannula. And now we are done being sterile. So now I can proceed with the cleaning. Go ahead and dampen my gauze, wring it out, and I will be cleaning around the trach with different parts of the gauze. I'm going to wring that out and still cleaning. Now I have my Q-tips. I'm going to dampen these, and we're going to get kind of under the collar here. Above the collar here. And I have my gauze that I will use to dry. I want to make sure that there's no excess moisture, which could make them prone for infections. And now I'm going to get my slit gauze, and I'm going to place it under the collar here. So get it up a little bit. Now, one thing that I do want to mention while I am here, I am never ever going to take, there we go. So I'm never going to take this band off of the trach because it could dislodge. If I did need to replace this band, I would take the new one and completely weave it through the little holes on the side there. I would completely weave it through, and once it's completely through on both sides and secured, that is when I will remove the old the old ties. And I will return my patient back to a comfortable position, put their trach collar back on. I will go ahead and clean up my mess, perform hand hygiene, ask the patient if there's anything else that I can do for them right now. And that is trach care.